Together we achieve victory over heart failure.
Hello, my friends and colleagues. I am Dr. Chandrashekhar Makhale. I am the cardiologist and professor of cardiology and director of cath lab at Ruby Hall Clinic, Pune, which is one of the premier institute in the country. Being a cardiologist, I would like to address few things related to the heart failure. And there are a lot of misconceptions about the heart failure. People try to miss between the heart failure, heart attack, and cardiac arrest. And there is a lot of form of misinformation. The condition heart failure means the heart is unable to pump the blood to meet the needs or metabolic needs of the body. So it can be a slow or long-term steady process in a worsening of the heart failure. Is a particular age at which heart failure occurs? No. It can happen to anybody. It can happen in young patients. It can happen in the pregnant ladies. It can happen in the elderly patients, or it can happen because of various conditions called as a cardiomyopathy, which are likely mostly because of genetic disorders, or it can be because of the lifestyle. For example, alcoholic patients or some toxins or underlying health conditions which lead to the heart failure. Each and every individual may have a different cause. All heart failures cannot be put into the one basket. But one thing is for sure that in a heart failure, the patient's heart is unable to push the blood to the entire body, and therefore there is a lot of fatigability as well as breathlessness. Now, is the chest pain that means a heart failure or a heart attack? Not necessarily. There are certain symptoms of the heart attack, like for example, patient complaining the chest pain over the chest, over the precordium. That means when you put your fist over the left side of the chest, that particular area, or even at times patients can have pain radiating or pointing to the left hand or neck or jaw or any other part of the body. There can be variable presentations, but one thing is definitely sure that patient will be very restless and this pain is really disturbing. In certain conditions, patient may feel dizzy or shortness of the breath or sense of nausea or there can be vomiting also. So if there are the certain symptoms and signs, the patient should attend the medical services as early as possible. Now, question is now this is about the heart attack, what we call in medical terms called as acute myocardial infarction. That means a death of the muscle, cardiac muscle, or a territory because of the lack of blood supply or because of the occlusion or total block of the blood supply. Now, heart failure means whether the heart has stopped. No, these three conditions are totally different. Heart failure does not signify the total shutdown of the heart. Rather, it refers to the condition where heart is struggles to pump the blood efficiently throughout the body. Because the blood is heart is unable to pump, one thing happens that all organs in the body they are suffering because of the loss or reduction of the blood flow. At the same time, there is a congestion or the backward flow. It happens in the lungs or legs, and patient may complain of breathlessness or he may complain of the swelling over the ankle or a feet. So this is what is a condition, what is called as a heart failure. Now let me allude you that conditions such as the heart failure, which is a slowly deteriorating condition, or it can be the acute heart failure also is a known thing, which happens in acute myocardial infarction. Whereas the cardiac arrest or heart arrest, that means the heart has stopped working completely. There is no pulse, there is no cardiac output, there is no heart is not pumping. And this is the most dangerous condition where the patient has to be resuscitated within a 3 minutes. Because if the blood doesn't reach to the brain in the 3 minutes, the patient is a brain dead. So even if you get back the heart, the patient may be still dead. Now, so in that condition, what is called as a heart has stopped. But heart failure, heart attack, and cardiac arrest or heart arrest, these are three different terms and they have got a different connotations. Now, does the long-term smokers have got a certain risk. Yes, smoking is one of the underlying cause for the heart disease. It narrows the coronaries, it causes the rise in blood pressure. So obviously what we advise a person, quit smoking. Now quit smoking is very easy to say, but difficult. But by counseling, if we tell him that he agrees to it, then he stops smoking. Now, does it mean that he stops today and patient will be all right, a person will be all right next day? No. At least for 1 year, his chance of getting, after the 1 year, at the end of the 1 year, the chances of getting the heart attack are reduced by 50%. But mind well, it is an exponential graph and it takes almost 10 to 15 years to get rid of all these ill effects of the smoke. So we do advise that a person should not smoke, and if at all is smoking, he should stop it. Now, because as I said, the heart failure means heart is unable to meet the blood supply to all organs during the exercise or any activities. So at that time, because there is a demand supply mismatch, patients will get symptoms. So then we try to give a rest to the heart. Rest to the heart means what? Heart is an organ which stops only once. That's all. It starts at the birth and it stops at the death. There are the various conditions which are going through in between. Now here, if patient wants to do the exercise, they can do it. They can do it under the professional guidance of physiotherapists, cardiovascular physiologists, and a cardiac specialist to bolster the cardiovascular health, because it is very essential that a failing heart also, if treated properly with exercise and medication, the most important is medication and diet, it will definitely boost the endurance and significantly it elates the patient's sense of well-being. Look, I was not able to walk previously, but now I can walk, and it can make the patients uh, with the overall well-being feeling for the heart failure. So, with the proper care, proper habits, proper diet, quitting the smoking, etc., and following the medications as advised by a cardiologist or a physician or their doctors, the patients can have a long life and they can be treated easily and navigating these conditions with the resilience and determination. So don't get afraid with the term heart failure. It can be treated. There are lots of medications are available and also certain new devices, some types of pacemaker, etc., are also available. And eventually, if nothing works, still the patient is a heart failure, we can think of left ventricular assist device, that is a artificial heart, or even heart transplant. And proud to tell you, we have got a lot of patients who have undergone the heart transplant who are surviving more than 5 years so far. So all these patients can be definitely treated. There are the various drugs are available. The new drugs which are available over last 5-10 years, they are definitely helping these patients. And all these four different types of the drugs will definitely improve their clinical conditions. And I have seen a patients where the patient's left ventricular pumping capacity, which was at 20%, has returned back to 50, which is in the normal range. In the normal range means 40 to 70%. So I have got a lot of patients who have been treated with these medications and they are doing good. The only important thing is first come out of the fear, follow your doctor's instructions, a healthy lifestyle, diet, and graded exercise. With this, I would like to thank everybody for this patient hearing. Thank you very much.